Hi, welcome to Post Call Beyond the White Coat, the podcast where we explore how doctors are impacting healthcare differently. I'm Dr. Selena, your host and co founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. So join the movement and sign up on our website to connect with a community of forward thinking doctors who are impacting healthcare differently. So today I'm joined by Dr. Ashwita Ravindran, an aspiring doctor whose journey from uncertainty to confidence is truly remarkable. I first met Dr. Ashwita early in her career when she was really unsure about her future path. She volunteered with us at Disruptive Doctors for a while, and I had a privilege of watching her grow into a confident and passionate professional. So, in fact, Dr. Ashwita secured her job at Sunway Medical Center through our platform, and since then, she's continued to carve out a unique path for herself in healthcare. Dr. Ashwita graduated from Malacca Manipal Medical College with dreams of making a difference as a doctor. But life, as it is, took an unexpected turn when a spine injury forced her to quit her housemanship in 2021. Now, being unable to practice in Malaysia, she faced the challenge of redefining her purpose beyond the profession she has dedicated her life to. Now, in the midst of COVID-19 pandemic, with limited awareness on non-clinical roles for doctors, Ashrita ventured into various fields, from health, journalism to hospital management, and eventually found her true calling in the pharmaceutical industry. Now a medical affairs manager at GSK, she continues to impact healthcare differently while pursuing an MBA. So join us today as we deep dive into her journey, exploring the highs, the lows, and the lessons she learned along the way. This is an episode you don't want to miss. So if you're ready to be inspired by your peers who are leading change in impacting healthcare differently, stick around. This is Post Call Beyond the White Coat. Hi, Ashwita. Thanks for joining us today.
Hi, Selena. Thank you very much for inviting me today. It's been a pleasure. It's definitely a pleasure to be here today.
Yeah, it's been a while. I mean, you came and joined us, you left, and then now I'm interviewing you to give back and share your
Yeah,
experience.
yeah, very interesting journey. I think before we even go in, like just to say that whatever I'm speaking today, it's not representing the organization that I work for. But again, just very nice to be here for our disruptive doctors. We've been, I think I've learned so much. It has been like a buddy to have you and Dr. Vivek alongside, like coaches or mentors, we call it. Yeah, so very grateful to now even be back here and share my story today.
Yeah, thanks. I'll start from the beginning, Ashwita. Like, what initially drew you to medicine?
Yeah, so initially when I mean, I was a very not very healthy child growing up. Actually, I had many medical conditions, and particularly I used to have an orthopedic condition that no one could actually diagnose. So I actually went through that particular journey for about 4 years until and when there was one specific ortho surgeon who actually could pinpoint on what was my condition, and that whole journey actually kind of grew my interest. This was back when I was in high school towards medicine, and how that one little it can just be a daily thing, right? The doctor just diagnosing you, but that impacted my life. That diagnosis itself, I think, gave me so much of relief before even I could actually go through the treatment. So that kind of impact that a doctor has sort of drew me towards medicine. Secondly, is also I was always inclined towards the sciences, and I believe also medicine is something that you don't do the same thing every day, right? You meet different patients, you talk to different people, you work on a different case. So those things about medicine sort of drew me into this particular career.
Wow. So, a doctor who treated you gave you that
Yeah,
inspiration and inspired you.
yeah, and in fact, the day I think I went for the surgery, and after that, the last follow up, he actually gave me an anatomy book because he knew that my interest in medicine grew, and he sort of gave me like an anatomy book as a gift before he discharged me. Yeah.
Wow, that's very thoughtful of him. I mean, who is this?
It's actually Dr. Tiru. He's an ortho surgeon in Malacca. He's one of a very top ortho surgeon in Malacca.
Wow. Okay, tell
Yeah.
us a bit about that back injury. Like, how did that affect you?
So actually, back in medical school, I was studying in India, and I'm also a dancer. So I think throughout my training, or I think some one of the trainings that I had in dancing in India, that sort of uh, had gave me that kind of injury. I think I fell backwards or something like that. I can't really recall, but it just started off with lower back pain, and then when I started clinical training, where you have your year 4, year 5, right, where you had to start going to the wards, that's when my pain became more severe. This was like back in medical school. So specifically, certain postings that where you have to stand for a long time, where I have to go to OT and tag. So when I had to stand very long, then I would have that pain triggering. So even so much so, during my medical school, I used to have to take or even get admitted for about 1 week for pain management. So it kind of affected me already before medical school, and somehow I managed to pull through and complete it. And yeah, it was not as, because again, you're a medical student, right? It's not going to affect your job or and whatnot. Then later on, prior to housemanship, because I did have friends who were also generally concerned, like, oh, okay, how are you going to manage housemanship then? So I did go through like multiple pain management treatment. But and before housemanship, I dedicated 1 whole year during the waiting period to go through intense treatment for to prepare myself for housemanship. Unfortunately, I think within the third month of my housemanship, the pain like sort of came back. And even despite during that time itself, I went through like an epiduralysis, tried to relieve the pain. Nothing really helped, because I also couldn't take that time off fully to recover, because we are contract, we can't take MC, otherwise there's so many other complications with the system and processes within Ministry of Health. So yeah, so it kind of, it was very difficult on a day to day, because I was in ortho posting and I was dealing with patients who present with back pain, but their pain score could have been like 4 or 5, but I was treating them or even clocking them with a pain score of 8 or 9. So it was very difficult, and I even had to like put in an IV line just to give myself IV trauma just to carry on the day to day. And I felt that I was not giving my best, because there was a limitation within me because of the pain, and I didn't like that, number one. Although I couldn't, that going through the day to day was already a challenge, but not being able to give my best was also another hurdle that I personally struggle, because then I'm not giving my best to my patient, which kind of was a big struggle for me.
Did you face any sort of stigma from your colleagues?
Not particularly, because I think it was quite quick when this whole injury just sort of came back, that acute on chronic thing. So I try not to, I don't think the workload was so heavy, to be honest. It was also going towards the COVID time, and I don't think I had like a very bad, I had really relatively good working environment there, but it's just that I couldn't, it was me basically, physically I could not do it. So I don't think I really faced any stigma. I had quite a supportive group of colleagues.
That's pretty good because I know what a back injury pain could be because I had a slip disc in 2017. Worst part is I didn't even know it was a slip disc because
Yeah.
the pain was not what you studied in textbooks. Yeah, was it the same for you that the pain was not textbook classic?
Yeah, it was like, sometimes it's just pain, and then suddenly you'll get radiating, but it's not really like how they put it, you will have that pain and then it shoots down. Sometimes you can't even explain how, where's the pain, because it's just there, it's just lingering until yeah, it's not really textbook or classic pain symptoms or signs, yeah.
Okay, so like when you had this pain, and how did you decide that you had to stop housemanship? Was there a process to this?
Yeah, so initially I think because every day going to work was already very painful, so every day was a struggle for me. I had to take like down medications and painkillers. So while I was going through that, I had my husband who was then my boyfriend, and then my family members with me. So they saw me going through it on a day to day. So initially we sort of discussed to go for the treatment, which was a pain management epiduralysis procedure, which I did, thinking that it will help. So this was during that period itself, but unfortunately it didn't help, because I mean I was only given 2 days of MC and then to go back to work. So generally, any procedure, although it may seem like a very simple procedure, but your body is already in an inflamed state, right? It needs to recover first before then going back to the whole thing again. So I did not get that post procedure recovery time, and going back to it. So I actually had like a lot of discussions with my family, my parents, and the plan when I before I resigned was to recover, go through some kind of treatment before I can continue back. So it was my initial plan when I left was to quit, recover, and go back. I did also consult with a few medical officer friends of mine. So they shared that, now you're a houseman. If you're in pain, you can always rely on your colleagues. They can always help you out. But when you're a medical officer, if you're on call, you're the only one who's looking after the whole ward, for instance, right? So that kind of responsibility with your chronic pain is not going to be easy on you. So even if you don't, if you even if you quit now, later on it's not going to get easier. People always say that you just quit and then, or just last stand and finish, get your registration and go to a GP practice. That's like a solution for anyone who finds it difficult at any point of housemanship, right? Which I feel yes and no, but because in my situation, because going to the next phase, it will be more difficult for me, at least physically. So yeah, I did consult a few people. So the idea before I quit was mainly to recover and come back to clinical practice.
What was it an easy decision to make?
I think I was in a lot of pain, to be very frank. So until and when I quit, it only hit me really hard when I left the hospital, when I tended. Like, what do I do, right? So initially, it was like all like, I just don't want to work. I just want a break because it's so painful. But when I resigned, and then when I came back home, and when I was driving back home, then I was like, what am I going to do? So that whole, from that time onwards, then it just really, it kind of went south for me in terms of emotionally. Yeah, so it was not, it was relatively easy to resign, but to deal with it was difficult.
Okay, so now you have to deal with this reality that a childhood dream of yours to be a doctor, to serve the community, and now you're not able to complete your housemanship, which really means that you cannot practice as a doctor in Malaysia. So how did you deal with it at that time?
So because initially when I quit, I had the idea that I'm going to go back to practice because I'm going to recover. So I wanted to channel my energy in the process of recovering. So I did not think, or it did not cross my mind that it's the end. It's just that I am delayed. I'm behind. I'm falling behind. And I thought that the process of reapplying, and I guess it's also the fault on my end because I did not do a thorough research on how to reapply, what is the process like. And later I found out that you only can reapply after like 6 months. You need like a cooling off period. Then you process, or the application process, it's not straightforward. You need to go to MMC, then you need to go to MOH. You have to go through an interview. So by the time your MMC documents reach your MOH, your letter of clearance from your doctor would have been expired because it would have taken that much of time. So then when you go to MOH, MOH reviews your letter during the interview. They will say your letter expired, now go back to MMC and submit again. So it was kind of ridiculous. So that whole delayed process, because I was always like the student, or like what you call it, that one who is like, always goal getter, right? Suddenly to be at the back, right? It really affected me because that type A personality thing, like, what am I doing, right? What am I doing? All my friends are, moving along. They have completed this many postings. When I join back, does this mean I'm going to be a junior? Because I've never fall back. This is the first time for me. So dealing with that, because of how I grew up in a very straight A, or A type A personality person, it was very difficult for me to accept that I'm not in the front of the, taking that whole step back. That was the challenge for me. Yeah.
How did you overcome that?
I don't think I overcame it until only when I joined Pharma, actually. So because I didn't know what I wanted to do when I quit, right? So I joined Code Blue as a health journalist. So when I joined Code Blue as a health journalist, in fact, it was all something that I was doing while doing my treatment, while trying to prepare myself back again to go for housemanship. So it was something like a side job, but it was a full time job, lah. So I kind of, when I then after that, simply, I saw the post on Medic Footprints back then, and then I applied to Sunway. Even then, I didn't 100% think I'm not going to go back to clinical medicine, I still felt that this is just, it's going to happen, but it's going to be taking some time. So that kind of thing, that those jobs kind of like helped me divert my mind a bit. Then when I went to Sunway, the process of reapplying took too long. It was almost more than a year. So my parents themselves told me that you're already in this hospital management. Why don't you make full use of it? Like, it's something, even if you go back to housemanship, what if you get back the pain? What if it's going to get worse again? Then you have to start all over. So it was actually my parents and my husband who kind of encouraged, my family who kind of encouraged me to like just pursue this. So they gave that encouragement. Although they gave those encouragement and those words, it's still, I was still conflicted. Like, what am I doing in Sunway? What am I doing in Code Blue? And I think also another main thing that affected me was the salary. So when as much as they say that a doctor's salary is low, but when you talk about a starting pay, a doctor's salary is still definitely higher than any other profession. So when I left KKM, or when I was in KKM, you earn that amount of money. But when you leave KKM, you're considered just a fresh graduate of any science degree. So then you get paid half the salary in any job that you get. Then from that half salary, if you move jobs, it's just like 20% or 30% increment from that previous job, not from your KKM role. It's very odd unless you get that whole full registration, right? So that also took a toll on me, like, okay, so this is not going to be easy because your salary is like lower. You don't know what you're doing. What is this whole thing that you're doing, right? Yeah. So I guess all that kind of played different impact on me on whether I'm going to be fully accepting of this. But when I joined Pharma, when I realized that this is something very strongly related to my medical knowledge, I'm creating an impact differently. Even the salary and the growth that I can see in Pharma for a doctor was totally different. Then I kind of had that acceptance and fully became happy with what I'm doing. And I kind of found my purpose and my passion back again, as how I used to be passionate about medicine. Now I'm passionate about what I do. So that really played an impact in my confidence and how I started seeing everything differently.
Are you still thinking about, should I try housemanship again? Should I try to get back into clinical medicine again? Do you still have those thoughts?
I used to, until I joined Pharma. To be very frank, I would even, like, if I go to Sunway, right? So I was working in Sunway. Even if I go to a ward for whatever reason, for work or related purpose, then I would be like, oh my god, I wish I'm the treating doctor here. But today, although my day to day is in the hospital, I don't wish to be on the other side anymore. I'm quite happy with what I'm doing. Yeah.
Well, what exactly is it? Could you pinpoint it? Like, why, when you were in hospital management, you still had that thoughts, but in pharma, it's like you're accepting and you realize that you're doing more.
I think the opportunity that I had maybe in that particular role, I was not able to reveal my or give my full reveal or give my best or potential. That's why I felt the role had its limitation. And number two, then I felt that it is, although there was a bit of here and there touching to on the science part, it was not fully scientific, right? Because I enjoy science. I enjoy the science part of medicine. I really like it. So I was not in touch with my medical knowledge, at least maybe only 2 to 3% of it. So I had a good understanding of the healthcare system, which helped me in my work. But in terms of the science part, it was very minimal. So when I navigated to pharma, where I'm actually fully immersed in the science, this is my core role. I'm speaking science to my doctors, to the key opinion leaders in the healthcare landscape, right? So then it's all different because we are like considered peers to the doctors, or we are sharing and exchanging scientific knowledge. So that kind of thing kind of grew. I really like those part of the job lah, that it's very inclined to the science. So that's where the difference is for me.
Sounds like you're feeling, you feel, it sounds like you found your purpose, because if you're going to revisit back, why did you become a doctor in the first place? You love the science of the science of medicine, art of medicine, and everything about treating a patient. Sounds like that's why you're feeling satisfied and purposeful right now.
Yeah, and I always actually I was very inclined towards internal medicine. It's like a puzzle, right? So even now, when I feel like my if a doctor asks a question about this, that sometimes it's not related to your product, but about the disease and whatnot. So it's like a I really enjoy like finding the answers for them, or trying to put the puzzles together, or even internally if they have questions, I really like to get that answers for them, because sometimes it's some things that you don't even think, but it's like sort of is basically the core is the science lah, like you rightly said.
Wow, yeah, I actually even now for me as I'm running Disruptive Doctors, whenever there's a case, a complicated case, it's got nothing to do with Disruptive Doctors, but I'm ready to think about
Invested.
what. Yes, I'm invested. I'm like, okay, these are the possible diagnosis, and I think this is how the pathology is, and then this is what you can do, and like I think this is the treatment plan, and then I love thinking about all that stuff. So I guess I understand
Yeah,
what you're where you're coming from on that.
yeah, it's like a it's like a puzzle, I would say.
Like Dr. House.
Yeah.
Okay, so you mentioned that you've explored various non-clinical roles from health journalism, going to hospital management, finally landing in pharma. What was the journey, the challenges you faced? I know you went to clinical medicine like not too long before you ventured out into all this other stuff, but in medical school, we are mostly never taught about anything other than medicine. So, what were the challenges you faced?
Yeah, so the when I joined Code Blue, it was such a big eye opener, because we only know about medicine treating patients, right? So I remember the second day of my job, I had to go to Parliament to meet members of Parliament, and to discuss with them about healthcare policies. And I was like, "What is this? Who is this?" Firstly, I didn't know who is who. I probably didn't even know who's the health minister back then. Now I can say it out loud. Yeah, so I was so clueless about the whole policy making and everything. So it was a real eye opener to me, because we can't just simply go there and start talking about things that you need to have some kind of knowledge about what is going on. So to sort of I had to look back, do my research on the whole healthcare system in Malaysia, who is responsible for what. And some of the challenges was actually speaking to really big people like your health minister. I used to be in press conferences with health ministers, and even the I think there was once with um, the opposition leader, which is Dr. Sri Anwar Ibrahim. So I remember all this. It was very nerve wracking, because you have to ask them questions, and sometimes your questions, they may not like your questions, right? Because you want to fight for you want to speak on behalf of the people, and it was during the peak of COVID, so people are more than happy to ask so many questions to the government, and they want answers, so we are representing them. So yeah, it was a huge challenge to actually go and ask, speak up to them and ask, like, so why is this done, or so why are you getting this. Yeah, so that was a bit of a reality. It was a huge shock to me to go through that, and then to understand the whole policy making and everything. But what helped me was to do a lot of research. I didn't know how to write an article. I have never written an article. So I used to spend a lot of time revising, or reading up how the foreign health news portals, they write their articles. So I used to, spend a good amount of time reading up, trying to see where I can use my medical knowledge in a sense of what are the gaps here and there, and then try to connect the dots and see where there could have been a potential gap. So I think one of the highlight that I remember, I was also quite always inclined, or I was always interested in this whole methadone clinic concept. So I actually kind of had that curiosity on how, with the whole COVID lockdown, how these patients would actually go out and get their methadone. And because they are patients who need to get their methadone, and they may or may not be completely off their drugs or substance abuse, right? So will they then want to go out and be in the roadblocks with police officers there? So all that kind of stories sort of used to go and find out, and actually go to the ground and write stories about that. I even managed to interview a few of the methadone clinic patients. So those kind of things, these unheard stories, were actually very, very interesting to write about. It kind of opened my eyes to know what a story, or what an article could actually impact our healthcare. So I remember also writing an article where there were a few doctors who spoke to me from Sabah where they did not have mask and PPE, and after I wrote the stories, immediately help was sent to them. So, and doctors messaging me, oh, thank you for your article. So those kind of things, I realized you can actually impact healthcare in so many different levels, right? It just depends on where you stand. So it's not just because you are out of the hospital, you're not going to make a change to the healthcare system. So that is how it kind of motivated me and inspired me to actually further continue in what I was doing or what my whole adventure was.
Oh, when you mentioned Parliament, just a fun fact. I also managed to get myself into Parliament. Vivek and I, we met the Health Minister,
Mm,
Dr. Zulkifli.
yeah.
Um, oh, it was nerve wracking. I don't think I would know how you feel, but even for me, I wasn't sure what the protocol was. I wasn't sure if I could speak directly to him. Am I
Yeah.
allowed to shake his hand? There was so many questions in my head as well, and so I just allowed Vivek to lead. But I can see if it was you, you had to lead it. You have to be at the front, and you have to take that step, right?
Yeah, and I remember there was once, I think my editor in chief said, "Oh, you can ask this member of parliament about it." Then I was like, "Okay, so but how do I ask?" Just text him. So I was like, "Oh, I can just text this person." So suddenly I realized that I have all these people's contact because we can just text them and get their quotes and whatnot. So it was really, really eye opening. Like, wow, oh, this is a whole different ball game. Yeah.
Wow, so you have all the most powerful people in Malaysia's contact in your phone.
Yeah, yeah, I used to actually. Yeah, but now it doesn't apply. They won't know who am I already lah.
Okay, before we continue, I want to share something special to our audience. If you're a doctor considering a career shift, Disruptive Doctor offers a non clinical Pathfinder workshop, which is designed to help you explore new opportunities beyond clinical medicine. So, whether you're unsure of what your next step is, or if you're ready to make a change, this workshop is tailored for you. And our next workshop is happening this October 6th. So, visit our website for more details. So, Ashwita, you moved from hospital management into pharma. It is in healthcare, but it's not exactly, within the healthcare management itself. How did you get that job?
So I actually took well. It started off with people actually telling me, "Why not you try pharma? You know, it's quite a good career growth there for doctors. It's scientific." So I started off applying, but it took me about 1 year to actually get the job. So I did try. I had to attend few interviews. A lot of times, pharma companies were actually looking for people with experience in pharma, which was a downside for me because I did not have the experience. So lucky enough, the first role that I got, they were quite open to not to having someone who would without the background of pharma. So I managed to get the role, but it is considered the most junior role in a medical affairs department within pharma, which is a medical scientific liaison. So I started off there. So that's I just applied for 1 year. I was just trying applying here.
What do you think is the biggest challenge for a doctor who's trying to break through into pharma?
I think now it's very competitive because a lot of not only doctors, so pharmacists, and you have your those who hold PhDs, they all want to try to enter pharma. So doctors usually we restrict ourselves to entering medical affairs department in pharma, but actually there are many other departments, the commercial roles and all, which is also again sometimes they are looking for people with experience, right? So the other easier way would be a medical sales rep, but not everyone would be keen to take up that role. At least most doctors are not ready. It depends whether you like sales or not, right? So that would be an easier way to join into pharma and then grow your way up lah. Yeah. So now
So
it's
what
just
do you
competitive, very competitive.
what do you think was the key the most okay, so what do you think made it successful for you? How did for you said you managed to get a role, but most pharma companies would want doctors who have experience, but you had no experience in pharma. So what do you think was the key point of that success of yours?
So I try to extract what I learned from each of my roles and put it in, like for example, communicating with different stakeholders in code blue, like from your regular citizen of the country to your politician. So that is like an added point because communication. So I kind of look back at what is the job scope needs, right? And then try to connect it with what I have had with my past experience. So I use those things to present myself during an interview. Of course, in your resume you can only tailor it as much. So it also, it's sometimes it's also your luck, right? Whether your resume falls in the right person's hands. So firstly, you need to I kind of tailored my resume according to the job scope, and link it back to what I've done. And secondly, during the interview, of course, you need to provide solid, concrete examples of why, without an experience, but you can still bring value to the job, which is what I did lah.
Okay, so now you're working as a medical affairs manager at GSK. Like, how do you see your role impacting healthcare differently?
So I'm actually in charge of. I was brought in for a pre-launch product, and then I got promoted. I also got to take care of another pre-launch product. So bringing in new innovations to the country, I think that is a huge thing, because a new drug or a new a product that you bring into a country that's impacting patients' lives in a whole different way, right? So doctors start implementing it and practicing and using it, and how it can you can see patients' lives improving from it. So that is, and being part or being a core member of that whole thing truly is very rewarding, actually, because you can see that you're bringing an innovation to the healthcare practice or healthcare landscape in Malaysia.
So, what's the most fulfilling, or what do you find most fulfilling in your current position?
I would say that whole so because when I started it was a pre-launch product, and then when it gets authorized, and when you see that whole end to end where it goes to the patient, right? And you know that the patient's going to benefit from your hard work, you were part of that whole process. I think that's really rewarding, although you are not directly treating your patient, because you're no longer I'm no longer a clinician, but I'm part of the process that bringing innovation for the patient's benefit, and not just one person. Because if I'm a clinician, I have a capacity, right? A maximum capacity, maybe I'm going to treat few patients a day. But looking at this, I'm impacting healthcare at a nation level. So that is how I tell myself, of course, sometimes, if even if you think back, oh, whether I did the right choice, I studied so much, but I can still think back and say, no, I'm impacting patients' lives, but it's in a different level. But instead of just changing one patient's life, I'm actually helping more patients actually through my work.
Yeah, I think that's a very sage advice, and it's very wise the way you're looking at it, because at one point in my career, when I no longer treat patients like as a clinician, like on one, I felt like something was missing. Like maybe I wasn't doing the best I could, or I wasn't fulfilling what I'm supposed to be doing. But slowly, as I started talking to more and more people, a lot of people gave me that exact same advice. Like, as a clinician, you're only treating one person at a time. But that guilt of, oh, maybe I'm supposed to be a
Yeah.
doctor, I'm supposed to be treating patient. So but if you look at your role as a bigger scope, if like you said, you bring products in, you get it registered, and it's being used by clinicians, and they treat their patients, like hundreds or thousands of their patients, so you are impacting at least 1,000 patients' lives.
Yeah, I think when I joined Code Blue is when I realized that there's more to healthcare, right? So whatever you say or whatever you do, the actions are different at a bigger level. So you try to like sort of reflect, take a step back. The best way is to take a step back and see how your current job is impacting healthcare. Then that sort of can help you to to change your belief in what you used to think, right? From just impacting one patient's lives.
And also, on that note, I suppose you also have to think of the impact that you are creating. So you have to use it wisely, do it properly, right? Because like you just mentioned, like you wrote an article. From that article, it can change, cause a ripple effect, and if you did a bad job, you would cause a very bad effect across the nation.
Yeah, and I mean, I have had those experiences, because not everyone's going to be happy of your because sometimes you have your opposite. It's a political thing, right? So sometimes we need to ensure that I write the right thing, and it does not it can be, somebody can be angry, somebody can be happy. So it's always to find the balance between both, actually, and see what it benefits the patients the most. At the end of the day, I still think like a doctor. I still think for the patients. So I choose that path that kind of guides me to whether I'm doing the right thing or not.
Yeah, I guess we need a lot more doctors in those kind of positions, where you can make decisions and you affect patients like on a larger scale. So what do you think is the most challenging for you in your whole journey from code blue to, in healthcare management to pharma? What's the most challenging moment for you?
I think when I joined Pharma, maybe I already spoke that about the challenges in Code Blue, right? But when I joined Pharma, so I was at MSL, right? So it was actually go and feel and wait for doctors for at least 4 to 5 hours just to sometimes just be able to speak to them for 5 minutes. I used to I was like, oh my God, I studied for, 5 years, and sometimes you have to stand near the door and just pass the card. So those are the challenges that I never thought I had to experience. I never thought that, but it builds a lot of resilience in you. It builds a lot of patience, and when I look back at it, I'm like, I'm so happy and I'm glad that I went through all that, because today I'm able to understand, or if even if I be a leader in a pharma company or in a medical affairs division, I can understand the whole process from end to end. I'm glad I started at the bottom, where you go through the pain of building the rapport with doctors. And we're not talking about just doctors like a general practitioner. Now we are talking about heads of services, people who are at the top, right? So these are not people that you get easily get access to. So you a lot of patience, a lot of dedication, a lot of repeated work is required to build that rapport. So that is something that I've never been taught. We don't learn how to, we only know, we go and introduce ourselves in the ward and say who you are, right? We don't have to build rapport with the doctors technically. We just need to, I'm sorry, yeah, this is my fault, that kind of thing. And yeah, so I think that kind of made me very humble, because we always feel that, oh, doctors means you have a different standard of whatever it is. So it kind of made me feel very humble about myself, that this is how you want to grow, this is how you start, right? You have to go through the hardship, and you have to go through it. And it was very humbling, but it was very challenging. Sometimes you spend so many hours just for that 5 minutes, and you come back home, you will sort of think, like, but then you have to go back again and meet the next day is the same thing again. So yeah, so that was a big challenge. I think at least for the first 6 to 7 months of pharma, it kind of was a challenge for me in that sense.
How did you overcome it?
I have a colleague. We both we were in the same boat. So she covers different area and I cover different. So I think having a good friend and a colleague really helped me, because we share the same pain. So we kind of have each other for that. And also, I'm a person who always have my sort of my goal and my ambition, right? So because I have that in place, I build that resilience. I try to push through, because I know that it will one day be worth it. So yeah, that was my two supportive factors.
Yeah, I've also came across this saying. Someone that I follow, he says, "As long as you never quit, you'll never lose."
Yeah, because you still learn something out of it, right? You may not have gotten what you want, but there's always the learning from everything. Yeah.
Okay, so currently you're pursuing your MBA in healthcare management while you're working in pharma. So in this current role, I mean, since you're no longer in healthcare management, how does this MBA help you?
So at this point of time, at least for the first, when I was MSL, because I was fully field based, I was not really involved in the strategy plan of things. It did not really entirely help, I would say. But later on, when I started doing more strategy planning or be part of projects, then I feel that certain things that we learn in MBA sort of apply. So I would say MBA is more of certain things that you can take, because healthcare management is still a management, right? If you're talking about pharma, you're still managing something. You still have your strategy, you still have your projects and everything. So those kind of things are still applicable from your MBA, that you can still take it on. And in fact, a lot of the leaders in pharma also have their own MBA. So it's not just necessarily for those who are in healthcare management or hospital management per se. Yeah.
I see. So, what's your advice for doctors who are unsure of their careers, not sure where they're heading, they're feeling ashamed because they could not complete their training, or, just feeling like they don't belong? What would your advice be for these doctors?
Actually, for me, what I did was I just said yes to everything. I did not, I took any chances. Whatever job that came by, I just tried until I found my thing. Because sometimes you don't know what you want. Because our whole life we've been talking about medicine and clinical medicine, right? Suddenly, like, what is out there? I didn't even know what is out there. I had no resource. I had not much resources. So I just tried whatever that came my way. Yeah, I would say there's two thoughts, two ways of thinking. Is one is to be completely strategic and choose what you really want and drill down and go for it. If you have that privilege, you have that opportunity, you have those certification, then just go for it. Otherwise, if you are somewhere like somebody who maybe, just quit housemanship, you don't have much options, I would say just try what you can. Just go for it. And of course, you need to look at what a right non-clinical job that is suitable for you, that's suitable for your soft skills also. Yeah, so and just go for it and try, and then don't be afraid to change your path, because when you change your path also, people may think that, oh, again you're changing, right? But you need to sort of try, because we are so inclined, we have been trained for that particular role. We don't know how it works in a different, like I never knew how health journalism works until I joined it. I can just say or hear or say and understand, but I will not know until I experience it. Same for hospital management and same for pharma. So just go for it, try and see. Don't be afraid to leave if you feel that it's not working out for you.
Okay, so if doctors want to get into like pharma, what would you advise them?
I would say you need to build a strong network of, you need to build some connections within the leaders in pharma to actually understand what you need, what they are looking for, especially if you're already applying for a job, or there's a vacancy. I think it's best to connect with the hiring manager to actually understand more what they are looking for, because like I said, it's so competitive. The roles out there is limited, and not only you're competing with people who are outside of pharma, you're also competing with people within pharma who wants to properly jump, right? So it's always good to explore and understand what the hiring manager is looking for. And if you are looking more into a medical affairs sort of role, try to maybe go into a science related, like masters, if you have that privilege, right? Because some of them actually go and specifically go into masters of like neurology, oncology. Those kind of pathways are also something that makes you a bit more unique, because now it's just too competitive. But if you're looking for other roles, like you're open to commercial roles or marketing roles, then just go ahead and try, because I think there are more roles as such open out there. And then maybe your MBA and all that kind of things will be applicable. But the best way I would say is make sure people know who you are, because the best way is to connect with them, get to know them and network with them, and build your profile over LinkedIn, because it kind of helps with the recruiting and everything. Yeah.
Okay, thank you, Ashwita, Dr. Ashwita. So, if you are enjoying our conversation and considering exploring new career paths, remember to check out Non-Clinical Pathfinder workshop at Disruptive Doctors. Just to echo what Dr. Ashwita was mentioning, in our workshop, we actually help you to discover and navigate opportunities, discovering your strengths, your talents, and your skills, and navigate opportunities beyond the clinical setting. And we have a proven framework that has helped many doctors find their path. Also, to echo what Dr. Ashwita said, we have a annual conference where it happens every August, where like-minded doctors come together to share ideas and impact healthcare differently. And there will be many doctors who are leaders in the non-clinical field that will be there. Now, this wraps up our episode of Post Call Beyond the White Coat. I hope you enjoyed our conversation with Dr. Ashwita and found it as impactful and as inspiring as I did. Remember, there's always more to being a doctor than in the hospital walls. So, if you're a doctor who's ready to impact healthcare differently, join us at Disruptive Doctors, follow us on social media, and subscribe to our podcast. And don't forget to leave a review. Your feedback helps us bring more stories of doctors who are changing the game. So, stay tuned to our next episode where we'll continue to explore how doctors like you are making a difference beyond the white coat. Until then, I'm Dr. Selena. Take care and keep disrupting the norm.